India is the diabetes capital of the world. Every, I would say, 3 out of 10 people are in trouble. Either they are pre-diabetic or diabetic. Now, if I take that information and I tell you that I can actually avoid this happening to you, because once you become diabetic, it cannot be reversed in most cases. And therefore, you live with this all your life. Is this the life that you really want? Medicines and constant control? Rather, do the small things that you can do right now. So that's what I intend to bring to.
Ladies and gentlemen, thank you so much for joining us again on AskHowAbout. I'm your host, Pranay J. Reddy. Today, let's start with the term healthcare. Healthcare is pretty important, but as you may know, in the past few months, it's been trending. Obviously, it's because of the virus, or if it's for some other case, I don't know. But here's my question to you. Why haven't you been taking it seriously before that? Healthcare hasn't really coped up with our expectations of handling this pandemic. Yes, it has coped up well, but there have been some shortcomings. Now, why is that? Well, let me take you back to your childhood. You know how your parents told you guys that we are all unique and that we are one of a kind? And then we grew up and we realized we're all the same. Well, guess what? Apparently, we are unique. We, as humans, are similar but not the same. And what I mean by that is, it also applies to our healthcare, because the way your body reacts to a disease is different from mine. Hypothetically, let's say one person gets infected with the virus, another person as well does, but one of them is symptomatic and the other is asymptomatic. The virus is the same, but the person getting infected is different. The way their body reacts is different, and that is based on many different parameters, based on what they eat, how they live, based on the pre-existing conditions. And so healthcare can never be unilateral. It has to be different. It has to be personalized. Now, personalized medication is a big, long debate, and it's the future of medication, at least that's what people say. But for right now, we need some sort of guidance, some sort of personal protection system, rather, if you can call it that. And in this episode, we talk to a person who's developed a personal analytical health system so that it can guide you on your best practices to be the best version of yourself, or just be, healthy and safe. So the expert we have on today is Dr. Subhashish Sircar. He is the founder and CEO of Health Vector. His research areas include data analytics, predictive health, preventive health, and data science. And he's also known for holding a leadership position in NASA. He got his doctorate in material science from Michigan State University. He got his MBA from the Wharton School, has over 20 plus patents, and has received the Most Innovative Analytics and Business Intelligence Company 2015 award. So that's a bit about our guest today. Let's get on with the interview. Dr. Subhashish Sircar, thank you so much for joining us today, and I really am glad you're on the show with us. Thank you for being here.
It's my pleasure. Thank you for giving me the opportunity, Pranay.
Well, the pleasure's all ours, sir. The pleasure's all ours. And I'd like to jump in straight away. So first off, to give us context, to give both me and the audience context, what is your personal health analytical tool? Is it an engine? What is it?
So what it is doing is it is focusing on the individual. What I mean by that is the health of that individual is our primary focus. Now, that means it's a complex, thing. Human health is a lot of things, but we are starting off with some of the very basic things. Like we start off with the blood data. And once I have a little bit of the blood data, then I go ahead and I say, can you give me the physicals? Can you give me a little bit more of answers to personal health questions? And so we start to build the health story. So the analytics engine is now capable of taking in almost 300 plus parameters. Still a long way to go, okay? But it is capable of looking at 300 plus parameters. It's constantly creating that health story on that individual. And then finally, it is saying, okay, these are the things that would best, first we benchmark, and we then tell you what are the things you need to do to keep it there or improve your health. What are the things you need to do?
So it's kind of like a guidance system for health.
Absolutely. That's the right way to put it. I'm going to steal that from you.
Well, I'm happy to help. And that means that this was a big undertaking, to be honest, to collect so much data points and everything. So there must be something which motivated you to do this.
Well, yeah, my life turned completely upside down somewhere close to 2011, 2012, when I lost a friend of mine who
I'm so
was
sorry.
in India and I was in the US at that time. He was just 32 years old, a very close friend. I called him a friend, but he's more like a younger brother. And he passed away, giving us just maybe 4 hours of notice. I had talked to him 4 hours before that. And then I get a call from his wife saying that Shoptik is no more. And so that changed my life completely. How could this have happened? I quit whatever I was doing in the US, my 30 years life in the US, quit everything, came to India to see what took his life away. And slowly from there, it snowballed into building a company. I never came here to build a company to do all this. But that's what motivated me, that if I ever touch anybody else whom I can help, because once I went back and I started talking to the doctors and all about why, what took Shobtik's life away, it was apparent to me that the doctors knew he had some risk factors, but did not exactly know how to actually convey this information to him in a way that he could have acted on. So things never changed for Shobtik, and which is a shame because that should not have happened.
Well, definitely, sir. First of all, I'm sorry for your loss. I mean, it's a but it's a
Thank
compelling
you.
story, and I'm glad that you chose to do this, and I'm glad this hopefully can help prevent so many other like your friends in the future. I'm pretty sure it will. So one thing I wanted to
Thank you.
ask you is like, what did you notice which was missing from our let's say our existing healthcare model, which you aim to prevent from happening?
Very good question. So look, it's not like I'm collecting any new information. I'm collecting the same information that exists. Sometimes, yes, I add a few things that are usually not asked. For example, your lifestyle, your food habits, exercise habits, family medical history, known medical conditions, mental health, stress. All of these questions are sometimes asked also. But if you just take blood data, to get a report which just has some numbers to it and some parameters written on it, typically means nothing. You 2 days later, you wouldn't even know where your report is. So I wanted to change that. That is what the main idea here is. If you're even remotely interested in your health, if you think that health is important to you, which happens to all of us as we grow a little older, but if you have even a little bit of interest in your health, then we should be able to capitalize that, give you the pertinent information, and be able to take you one step further. That is one step of the whole thing. The other thing is taking a look at data holistically, not just looking at, oh, your cholesterol is out, your BP is out. Do something to do work with your cholesterol, do something to work with your BP. True, those can be done, but wouldn't it be better if I could formulate a holistic health story and then guide you through the processes that need to actually take place in a holistic way, so that when I'm doing something, I don't go and disturb something else somewhere else?
Right, definitely. Well, as a person in the field of life sciences, I'm speaking from personally. I know that every one thing which happens in your body is interconnected, as you very well know. But one thing I wanted to ask here is, what the what the isn't it like invasion of a person's privacy? A person can perceive that when you're asking so many intricate details of his or her life. What do you say to that?
Yeah, this is a personal choice. We are here to help. I cannot force you to do things. I can only tell you that I can help. I'm here to help, and I have helped so many people. And people who have received my help have come back with their parents, with their family members, and wanted their help extended to everybody else. So I'm certainly creating some value there. And, but I will not force you to do it. I will only tell you that what I can do and how I can help you. I mean, wouldn't you like to know? I mean, not everybody, I guess, and that there is an impending disaster, and that can easily be avoided. I use the word easily under quotes, by doing a few simple things, and you may not even have to face. India is the diabetes capital of the world. So every, I would say, 3 out of 10 people are in trouble. Either they are pre-diabetic or diabetic. Now, if I take that information and I tell you that I can actually avoid this happening to you, because once you become diabetic, it cannot be reversed in most cases. And therefore, you live with this all your life. Is this the life that you really want? Medicines and constant control. Rather, do the small things that you can do right now. So that's what I intend to bring to the
That's
people.
wonderful, sir. But in those people's defense, chocolates are pretty good. You know,
Yes.
sweets are pretty good. But
Mhm.
moving on to
I,
the,
I
yes,
will never tell you chocolates and sweets are not good because I consume them too. But at the same time, moderation and knowing that you have a better, you have a higher chance of getting affected. Maybe you will do things a little bit different from somebody else, right? So that's my only goal, is to give you that information in a consumable format so that you take care of yourself. My job is to just motivate you.
that's wonderful, sir. And that means also means that, for you to predict or rather even analyze a certain case, if you get right now, you need to have a lot of data points existing already, in order to maybe even say that, okay, this could lead to an possible outcome. How were you able to gather such a large amount of data points?
So we are a B2B2C company right now. So it's not so difficult because once I hook up to a lab or a diagnostic lab or to a hospital, then as soon as somebody does a health check or somebody goes for an OPD test and all that, that data is sent to us because we are able to then convert that into something like a smart report. We call them Health View Basic, Health View Plus. Those are the kinds of reports that we generate. And so getting that data hasn't been so difficult. And then some hospitals have actually, as I said to you before, have gone further in terms of acquiring a little bit more information on them, the physicals, not just the blood data. Some places they have given us ECG and echo data. uh, some places have been able to push the individual to answer the personal health questions. So data is flowing into us on an ongoing basis. We don't have to really put all that effort into getting that once we are back and connected. And incidentally, today, our solution, you can actually go to the top 4 or 5 diagnostic labs in the country, and you should be able to go in and ask for a Health Vector Smart Report or Health Vector's Health View reports, and you should be able to get them.
Okay, that's cool actually, and that would also mean I want to jump back to this point. You said 300 different parameters. So you use analyze or rather analyze 300 different parameters of, let's say, my cholesterol, my hemoglobin level, and then come up with a holistic report. Why did you choose those 300 parameters? Because there are
Okay,
a
as
lot
I
more.
said, I didn't have to choose. I didn't have to do anything new. The world was moving just fine. I just came in and put in a little bit of, what I would say, improvement in the process, or maybe made that a little bit easier for people to understand. So the same data that is being collected on an ongoing basis, there are lots of innovative packages, lots of innovative ideas out there. People know what to test. People have different things coming out on a daily basis. So we just get those parameters. We are not specific about what you give us. The more you give us, the more story, the more complete the story becomes. But other than that, we are not cooking up a new recipe for you to actually create. Give me that, and then only I can give you. We can give you. In fact, there are reports out there today that we generate without getting any data from you, in terms of clinical information coming directly from a lab or anything. It's an answer to 15 questions, and we give you a good idea of your chances of becoming and getting into trouble, and where you're benchmarking your health. So you can see how that works.
Well, that's great. But then I want to ask you this as well. Since you said that we're just fine tuning the age old recipe, did you find any new correlations between those 300 parameters or data points, or is it already
Yeah,
something
so I'm not fine tuning the recipe or those parameters. I'm just saying I'm taking that information and I'm converting it into something meaningful. So I'm not in the process of improving the packages and all that as of right now. I'm not forcing people to change that. Sometime in the future I will be able to do that, but as of right now I'm just focusing on making this better and more capable of delivering something that the end user can benefit.
Okay,
Okay.
so
And in terms of the correlations that you talked about, they are all correlated. So So what we are doing, and again, if you give me the opportunity to share my screen, I will be able to tell you how we work on those correlations.
Please,
Okay,
please. Do.
just 1 second. Okay, this is, can you see my screen?
Yes, yes, we can.
Okay, so what I'm all about is taking information and creating this holistic story. You talked about this link or interrelations. This is a perfect example. You know, a person on the left hand side, this is an actual person. If you look at it, all the parameters individually, you will not have a panic on this person, or you will not go and ask this person to act on it, because all the things that you see on the left hand side are see things that you see normally in people. But if the same person has all of these things, his age 30, his BMI is high, his physical activity is zero, he eats out mostly, his good cholesterol is low, his bad cholesterol is high, and then he has a family history and he's a smoker. That all those things, when they come together, now you're suddenly seeing a story on this person, which tells you you better start warning him, because when you do his risk calculations for cardiovascular diseases and or diabetes and all that, it's going to show a relatively high number. So that is what I mean by connecting the dots. And this is how our analytics engine is really working. It's basically taking, blood data or personal health data, running it through this analytics engine, which is looking at the past, present, and future health of that individual, and converting it into these kinds of either reports or insights that can be used. So we start with blood data, but then we are able to do different kinds of reports. The reports could be just blood data, or blood and physicals, or the questionnaire. So those are the kinds of reports I was telling you about.
Right.
Now, up to date, we have done this many users we have analyzed. We look at have sold almost 50,000 plus reports, maybe much more now. 300 plus parameters analyzed, 70,000 plus calculations, and 10,000 plus decisions per analysis that we go through. And we generate the solution in less than a couple of seconds. So that's what we do. This is what the report looks like, Pranay. Uh, it gives you an idea of your summary of your health, what you're doing well, what are the things that need attention. Goes into important parameters at a glance and tells you where the problems are in a group level and an individual level. And those parameters that are in trouble, only those offending parameters, we explain in a very laymanish term, and the language changes based on how far you have gone in terms of being in trouble with these parameters. And then we start creating those holistic stories where we start talking about, okay, if you have a problem with your HbA1c, your thyroid issues, your cholesterol issues, and your vitamin issues, can I give you a holistic approach to what fruits and vegetables you can have, what cereals you can have, what oils and fats you can have and avoid? All those things are done by this analytics engine. And then it tells you which doctors you need to go and see and why. It tells you, if you go to a nutritionist, what should you be telling them? And finally, it tells you what are the tests, follow-ups, and tests that you need to do in order to avoid future problems, or to create your story completely. And that goes for follow-up as well as additional tests. One last thing I like to add is, if you give me the answers to your personal health questions and all that, we are able to tell you what are your chances of heart attack and stroke. And we show you what are the simple things you can do or take care of, so that you reduce your risks down from whatever value it is down to a base value. So those are the kinds of things we do. I'm going to stop sharing and uh, go back to talking to you.
Wow, that's that was a comprehensive report, to be very honest with you. But I'm curious now. So you analyze so many five lakh people, 5 million people. Did you analyze?
No, we've done about 500,000
Half a million. Okay, 500,000.
people that we have analyzed, 500,000. Yeah.
500,000 or 5 lakhs. Yeah. So I'm curious. Have you ever come across one person who's perfectly okay?
Not one. Not one.
Because
Such
I
a
don't think.
such an important question. In fact, we used to give grades, health grades. Now we have kind of backed off from that, where you would give you A, B, C, D, E, F, just like you got an A in an exam, and you can get a F in an exam when you fail it. So it
I'm
was
pretty sure.
very difficult for us to find people with A's. Finally, we had to really work hard to start giving people A's, because we realized that um, those are the A's really that people are doing relatively well. You're human, you will have some problems going on with your health, and not everything is so important sometimes. And so we started marking them as A's. So you're absolutely right. Very difficult to find anybody who is
Exactly.
completely everything within the ranges, nothing to report whatsoever. Come
Because
close, but
my thing
not.
is, first off, if they're in the hospital, something's wrong. Second off, even if they are the picture of health, we do not know what's going on internally in our bodies because it's a dynamic process. Maybe for those few days or something, those levels might have been high. You know,
Yeah,
that
and so we also look at trending in the data. So we
okay.
look at to see if somebody is improving, somebody is getting worse. But more importantly, maybe there are, you wouldn't believe this, but honestly, to find out your chances of becoming a diabetic or not, I don't need to know your values of your blood sugar right now.
No, you just need
So
to know
there
my
are other
status.
things, other things happening inside your body. Your waistline, for example, is very important. Your family history is very important. Your exercise routine is very important. you know uh, so all these things are very important in order for me to determine your chances of becoming a diabetic. So you can imagine that we do find things that are not immediately related to your clinical parameters.
Well, one more thing I jumped out to me while I was looking at the slides you're showing. You said we can predict, when you can potentially have a heart disease. Now you can then you'll guide us, or rather guide the patient to say that doing this or doing following such routines will make sure that will postpone that. But it's still a prediction from a machine, if I'm not mistaken. So
Absolutely.
can it
What are the
be?
chances that it is right or wrong? Correct? Is
Yeah,
that your question?
yeah,
So let me tell you this way: it's all a probability, right? Probability is 50% when you toss heads or tails a coin. Now you have a 50% chance of being right, and you have a 50% chance of being wrong. Here, when we are talking about the solution that we are creating, you will notice that uh, these are algorithms that have been looking at people's health. They have been following people for a long period of time, and they have longitudinal data. So people with these problems over here end up having certain problems over here. That is the correlation. Okay. So if it's 70 to 90% of the time that is what happens, wouldn't you be taking some
highly.
precautions and not saying that I still have a 20% chance of not happening? That is always there. But if the stacks are if the odds are stacked against you, I would rather guide you into safety rather than not taking the steps that I can keep you safe.
Yeah, sure, sure. So I get that completely do. But my only thing with that was, is a human more reliable or a machine more reliable? But then machine has so
Data
much
does not
different.
lie. Data does not lie. Data tells you the story. You got to know how to interpret that data and not jump into conclusions just because you have some things. But at the same time, data does not lie. So the point that I'm trying to make to you is, what is a machine ultimately? It is what we are teaching the machine. That is what the machine is giving us an output back, right? It's just that because it can function quicker, we take advantage of that. Because it can think about a lot of things together, we're taking advantage of that. 300 plus parameters, we cannot think consistently and give you the right result every time, right? So machine is there to stay, machine is there to be utilized, and that is why we are using machines, and we will continue to use machines. Today, how many times do you actually say, what are the chances that the phone number to call Subhashish could be wrong?
Oh,
It's a machine that is guiding me into dialing his number. So things get better and better and better as we have more and more information, more and more data, and more reliability increases. That doesn't necessarily mean probability is a wrong science. So
yeah.
it's a fantastic science to rely on, provided you know how to use the data.
I mean, even human nature, if you think about it, it is based on probability, the things we do. But of course, emotions come in interject. Yes, but we do at a certain level think based on probability. So that is rooted in any form of intelligence. And so
Yeah.
I have to ask this to you now. So in the sense like, obviously now it's the pandemic, the coronavirus. So how good is it at predicting for that?
Yeah. So, I don't know if you knew this, but we had something called health vectors uh, coronavirus riskometer. We had created that, where you see, we are predicting your comorbidities, right? We even tell you if you are diabetic, what are the things you need to do. So we get a lot of information on an individual, which helps us place this individual in terms of the risk of contracting corona, contracting COVID. And not only that, what this riskometer was doing was it was telling you that if you do get infected, what are the chances of it being severe or fatal, you know so we were able to do it on those two levels, and it was used for quite some time. And you see today, the well-known fact is that if you are comorbid, then your chances of getting into problems or complications is much higher. Add to that, if you're high up in your age, if you're low in your immunity, then your chances of survival is less. Okay. So the point, and of course I cannot eliminate the whole issue of viral load, but what I'm really trying to tell you is that we did do that already, and we were able to tell people exactly what they needed to do in order to stay away from those
Uh,
severities.
well, then say, if I may, that means a lot of the testing which the so-called government needs to do, and it costs so much money. Can it be eliminated by this process?
No, see, we are talking about risk of getting. Whether you actually have it or not is what government is telling you, right? Because they're taking a swab from your larynx maybe and running it through an RT-PCR, and they're then telling you, okay, how whether you're positive or negative. That is a definitive answer. What we are talking about is, again, probability. What are your high chances of you have a very high chance of. And people right now, the knowledge is quite obvious to them now. If you have diabetes, if you have already been affected by hypertension, all these things are comorbidities. If you have an ill functioning kidney, those are things that are going to cause problems to you. So you have to be extra careful. If you're high up in your age, 80 plus, very good chance that you get into trouble. So stay away.
Yeah,
So
but
that's the probability that we talk about. What the government does is the testing of actual infection.
my only argument for this is, my advocate for this is in the sense like, if people have a certain number, a probabilistic number, okay, there's a chance you can get affected, there's a chance which can happen. Won't that actually, because I find that once something is quantified, it's much more real other than just thinking of it as chance.
So we used to give them, what we do is we give them, you saw the numbers for risk of heart
Yeah.
attack and stroke. Again, we give specific numbers. We are very much of a numbers company. So everything and anything that we do will end up eventually being a number, or something that has a number that we can associate with our, with our suggestions or guidance. So what I'm trying to tell you is the riskometer was not only telling you a number for your chances of becoming COVID, infected by COVID, but we were also at the same time telling you if you did get infected, what are your probability of it being fatal or it being severe. So we were always giving numbers. We were not just throwing it at the high, medium, and low.
Yeah, that's why I was asking you, like, why isn't this rolled out, in a bigger scale? And so I'm assuming that even if people want to check right now, they can go to your website and do it.
I don't know. I mean, we gave it our best. We sent it out as many social media outlets as we could. It has definitely been used for quite a long time, especially when the whole coronavirus was at a peak in terms of our awareness and in terms of our scare. At that time, it had huge adoption. People used it quite a bit. Now we are living with it, so I don't think people are too enthused about finding out their risks anymore.
That's Well, I can't comment on that, but I do hope, at least for the people who are watching, and do hope, at least for the people who are going to be watching when we spread this out, that do check it out, because having a value over your head, it also gives you an idea of like, okay, some of the things I need to do or cannot do. It's only good for
It's
you.
out
And
there. It's just that you just Google HV, health stands for health vectors, risk-o-meter, RISKO meter, and you should be able to click on it, and it is very easy, few 4 or 5 steps, and we tell you the risks and quantify everything out for you.
well, thank you. Actually, thanks for for all this service you're doing. But one thing I want to ask, I know you can't reveal the algorithms which actually go into the process, but I would like to know, like, where was the start process for all this in terms of computational process?
As I said, when my friend passed away, the main thing for me was the helplessness that I saw in front in the doctor's faces when I told him, this is a healthy guy. You know, what good is this health check if you could not prevent this problem? So, so what I realized is this: although they were very much aware of the risks, and they were probably able to actually go back and post the incident, be able to probably find out what was his risk number, and therefore what were the you know do a simple sensitivity analysis to find out what are the small things that could have been done to bring his risk down significantly so that he could celebrate more birthdays. So the point I'm trying to make is that it is not a tool that was available to them on the fly. Today, what was very important is not just doing the calculations, not just doing the analysis, but being able to take a lot of different parameters together, bringing it into the equation, and being able to give that solution in near real time. Okay, so that is what we are able to bring in front of the doctors, in front of the individuals. Still, I will tell you, adoption is not easy because it's not the way things have been. Once it becomes part of your life, and once we realize that this is what you need to do, keep tracking your risks, do the things that reduce your risk, it will become part of life. That's where it started. In fact, it started way before I started on all of this. I just gave it a little more shape, get a little bit more user friendliness to it. That's what our team is all about. And I'm glad to report that we have been able to do this for almost 500,000 people, and it's increasing at a rapid pace.
That's wonderful to hear, to be honest. So I'll just, before we finish off this interview, I just want to focus a few questions on the future implications of this. Now, is this the first step in terms of personalized medication? Can we say that?
See, personalized medication is something that has been around for quite some time. Okay. Definitely personalized guidance, personalized medication is, of course, a little bit far fetched, although, certain elements of it could be. We are never here to replace a doctor. We are here to improve the patient doctor relationship. We are here to provide the facts that the pharma companies may need in order to create that personalized medicine that you're talking about. It's a little bit further away, but it is bound to happen with time. Um, there are lots of companies that are working in just that space, personalized medicine. So I don't want to really say that. No, no. So what I meant was there are a lot of people working in this space, personalized medicine. They're looking at it more from a genomics perspective and trying to create that solution. So I mean, what I would say is that's a science by itself. We are more of a guidance in terms of the low hanging fruit, the simple things that you can do in order to avoid some of the bigger problems. Um, yes, our aspirations are to be there someday, but today, all I can tell you is we're not into personalized medication per se. We're not there to, guide a doctor. But what we are there is to bring all the information and facts in front of the doctor and telling them what they know anyway, but in a much more user friendly ways. And these are what I called actionable insights. And so happy to say that the doctors really love our solution, and so does the individual.
Well, I really am glad to hear that, both individuals and doctors, liking this. And I really do hope this gets further out, because, stuff like this, I personally believe will become the future. in a world.
Yeah, and when I talk about personalized, we've taken it to a level where we are telling you for your exact condition, what are the things that you should have food wise, what are the things you should avoid. So that is personalization. A personalization is telling you what tests you need to follow. Personalization is what are the other things that will complete your story. Personalization is telling you, yeah, just because your HbA1c is high, okay, which tells other people that it is either diabetic or pre-diabetic, we still have a long way to go in terms of being able to say, yeah, just because your HbA1c is high does not necessarily mean that you are a diabetic, because your iron levels are low, your serum iron, your ferritin are low. Therefore, HbA1c may not be a valid test. That is personalization, So we are able to personalize because we are able to take a lot of parameters that relate to you and bring it all under one umbrella and then give you the guidance.
Well, sir, the way I look at it is healthcare is really important. It's in fact the most important thing a person should care about. And if you have a guidance system for education, well, then you should have one for healthcare as well.
Thank you. And we are on our way to actually creating a personalized health app, which is we call it Health View. That is the app that it will be at, where you do your test anywhere. It doesn't really matter. You can upload your reports through a simple click of your camera, and out comes the entire solution for you, including the personal reports. We're in the process of launching that another few months, and that should be also out.
Well, that's impressive, and I'm looking forward to it. I'm pretty sure the viewers also learned a lot about what it means to be in this field, and also what it means to be a part of this personalized medication, or rather personal analytical medications. And so, first off, I'd like to say thank you so much for doing this. Thank you for taking the time for being on the show. It was a pleasure having you.
Thank you so much, Pranay, for giving me the chance. Really appreciate it.
Thank you.
Thank you. Bye-bye.
Now that concludes the interview. And as you've seen, there's actually something you can do, and go and check it out if you actually prone to getting infected by coronavirus or even other diseases as well. Now, while I urge you to go and check it out with the link we've given down below, I also want you to think about this for a second. The field of this technology is certainly going to be the future of medication. So there's a huge scope for people who are watching this. Not to, if you want to be part of this, do go check out the opportunities, because there are plenty of them. So, I hope this video showed the scope of this field and also was informative of what is already happening. So if you did like the video, please do like, share and subscribe. And if you did not like the video, well, again, you know what I'm gonna say. Please do like, share and subscribe, because that will be very healthy and safe for us. Thank you very much.